Hey guys, welcome back to the Recovery Lab. This is Mike. We got another session sit-in video today. Today we have another one of our athletes. He's actually 3 weeks post-op from a PCL reconstruction and a microfracture procedure. So this is an athlete that had this injury for quite a while, and then finally had to go the surgical route due to like that instability problem in the knee, as well as the condylar defect. Like I said, he's 3 weeks post-op, so you're going to see a couple of different things today. The first thing you're going to notice, he's still got a lot of swelling in this knee. So what I'm doing right here is a ballottement test, and basically what I'm showing you guys is his kneecap is just kind of floating in all this swelling, okay? So what I'm going to do with him today is some lymphatic drainage to kind of drain the swelling out of this knee, and then what we're going to do is work on some of these incision sites. So at about 3 weeks post-op, a couple of these aren't quite ready yet, but he's got some of these scars. If you can swing around here and kind of check out the medial side, you can kind of see a lot of this scar tissue is kind of like puckered up, and it's not really moving all that much. So we want to start freeing some of this skin up from the underlying fascial layer. So we're going to work on a little bit of scar massage too, and then hopefully that'll improve his range of motion. So stick around. I hope you guys enjoy. All right, guys. So one of the earliest things from a manual perspective that we can do with a post-op athlete is lymphatic drainage massage, okay? I know a lot of manual therapists will try to steer clear from doing any kind of tissue work with their post-op athletes for fear of like doing more harm than good, but I will tell you that 100% it is worth getting your hands on them, okay? Because the problem is right now he's immobilized, so his body's ability to drain that lymphatic system is compromised because he's not moving this knee very much. Okay, he's also got a microfracture, so he's not really fully weight bearing yet. He's limping around in the brace a little bit, but for the most part, he's not really able to flex this knee and walk normal, so he's not getting normal muscle activation. The problem with that is he's going to start to kind of pool a lot of swelling down into his calf, and I can already tell you that his calf feels very dense and hard, and that is a lot of the residual swelling that's kind of settled into that area just from gravity. So what we're going to do today is lymphatic drainage, and the key for this is less is more. You don't need a ton of pressure for lymphatic drainage to work. I like to use the analogy that your lymphatic system, the vessels themselves are like, overcooked angel hair pasta. They're super brittle, they're super small, and they get clogged up real easily, okay? So essentially this light circular pressure is a great way to kind of clear some of these lymphatic channels around the knee. And you can see the way I got them propped up on my shoulder here as a way to kind of continue to aid, let gravity aid in that drainage out of the knee, okay? So at this point in the healing process, I don't really use a ton of ice because icing will start to keep this swelling kind of stuck in the knee, whereas for him, he's better off doing like some ankle pumps, getting his leg up, walking as normally as he can, obviously within reason and as per his physician's orders, but also doing some stuff like the active recovery through his quad and just kind of get some of these things moving. So, we'll show you guys a little bit of that towards the end of the clip. How's that, bud? All right? Good. I'm not killing you, right?
No, good.
So I'm using probably, on a scale of 0 to 10, I'm probably using like a 1 to 3 in terms of pressure. I'm giving him a little bit more pressure kind of around his kneecap and then over his quad tendon, like I'm trying to milk this thing out. And also along the back of his knee. You guys probably can't see this, but I'm kind of using my thumbs as like almost like a hook. So as I kind of work in that like popliteal space, I'm kind of pushing any of that swelling out, especially the lymph nodes behind the knee is a great place to work. Another place that's really great to work for him is like on this medial thigh, like up into his groin. So that's kind of why I got him draped all the way up to the thigh, because I'm going to start to take this stroke on this left hand here all the way down to his groin, okay? And that's for really just to kind of milk out some of these larger lymph node areas that can really help us kind of drain some of this swelling out of the knee. Feels awesome, doesn't it? Yeah. Alright, so I have this little wedge board here. If you don't have one of these, use some pillows for this. But what I wanted to kind of show you guys now, if you come around this side, is some of this scar massage, okay? there's a few ways to do this. I like to use as little lotion as possible. In fact, one of my favorite things to do with this is if you have like vitamin E gel tabs, to actually like pierce the tablet and use the liquid that's inside. Vitamin E obviously is great for the skin, but the tablets, the fluid is very sticky, okay? So it creates a lot of friction when we're doing this kind of massage. Now, before you do any kind of scar massage, obviously you want to make sure that that initial incision is well healed. So you can see on Matt, some of these portal sites aren't quite ready yet. There's still some scabbing around them. But this one here is pretty well formed. There's no scabbing, there's no openness to it. And color-wise, it's in that like dark pink to purple range, okay? So this is still very new scar tissue, but this is the opportunity that we kind of need to start creating some shear force around this and kind of freeing up that skin from the fascia layer underneath. Now, this will kind of be a little cranky, like the skin will be cranky around this for maybe today and tomorrow, but you know, it's really important that we get this skin freed up so that we can restore the range of motion to the knee. Right now, this is a range of motion inhibitor, okay? So until we get this scar tissue and these fascia layers sliding properly, it's going to be really hard for him to gain his range back. So, you know, again, I'm going to work in one direction, and then I'm going to work back in the other direction, okay? And really what I want you guys to imagine is just kind of trying to push the scar over. Okay, so if you pick another area on his skin, you see how this skin slides really nice? It doesn't slide so nice here. So this is where we want to kind of create some range of motion in this fascial layer. So after I've done kind of more of like the superficial like shear work, the next thing you can do is really light Graston work. Okay, so these incision sites are still, I would say what I'm doing right now is more on the aggressive end of the spectrum. Like if you really want to be sure, like wait a month to 6 weeks before you really start doing aggressive scar work. But this scar looks really good, and it's definitely ready, okay? So what I'm going to do is just basically very lightly strum over that scar tissue, okay? So okay, so this light Graston work, obviously I'm kind of going against the grain here, okay? I'm just really letting the weight of the instrument do this work. I'm really barely putting any pressure at all. The idea behind this is going to stimulate fibroblastic activity and start to kind of help his body produce more robust collagen fibers, okay? So scar tissue is, generally speaking, it's type 1 collagen, which is very brittle, which is why scar tissue doesn't like a scar on your skin, you know, it'll burn faster, it'll cut easier. It's not as strong as the skin that was there previous. So doing this light Graston work stimulates the fibroblasts in this tissue to kind of spit out more connective tissue and more collagen and more type 3 collagen. That's going to be a little bit more, it's going to be more strong, it's going to have better tensile strength, and it's just going to give him, you know, better tissue quality. Kind of same process around this one. So I'm just going to repeat this process kind of around this second incision site that's kind of ready. Again, very light work. I'm barely touching him. It's the weight of the instrument. You definitely don't want to do aggressive work over these incision sites. All right, awesome, cool. So the last thing we're going to do, so I got rid of the board. I put his knee on a half a foam roller, or any bolster will do. And the reason I'm doing that is I really want to work on his quad now and kind of really, again, start flushing out his groin. His groin and his rectus right now are like rock solid because he's been in a brace and he's kind of doing that hip swing thing. Okay, so as he's taking that, you know, he's got an abnormal gait kind of going on, and he's going to start to develop some compensation. So I don't want this tissue to get super locked up. I want to keep it supple and keep the blood flow happening. But what I don't want to do is slam his knee into extension because that's going to be really uncomfortable for him. So right now he's in a great position. I'm just going to lube him up with the lotion and kind of just work this quad for him, okay? Any residual swelling that might be in this area, we're going to kind of flush this out and continue to work these lymph nodes in his groin. can see, I'm pushing pretty good. I'm kind of just doing like normal quad work with him. You know, as long as you take the necessary precautions and you're set up, you shouldn't really feel bashful about getting in here. You're, you know, creating this blood flow and just kind of giving him some sensory input into this area is a game changer, right? Right now, he's really atrophied from just inactivity and not using the leg. So just getting some of this pressure, even this mechanical loading of my hands, can be very, very therapeutic, okay? It can kind of help facilitate a better mind-muscle connection, okay? So yeah, in addition to his rehab and his quad sets and his exercise, doing some soft tissue work with your post-op athletes can go a really, really long way. All right, guys, so here's what we're gonna do. I cut this 4-inch Big Daddy Rocktape strip into like the fan shape, okay? I like to cut 4s on mine because it gives me about 1 inch on each of those strips. So, okay, so the first one we're gonna start is gonna be kind of up in his groin area because I want to pull that lymph to his groin. In a situation like this where I can't really put his skin on a ton of stretch because he doesn't have a very good range of motion right now, I'm gonna put some actual tension on the tape. Okay, it's better to put the tissue on tension, but in this case, I'm gonna opt to put tension on the tape as a substitute, okay? So we're gonna peel this anchor piece off. I'm gonna kind of lay this in his groin area and rub that down. Okay? So now one at a time, I'm gonna start laying these over his knee, and I'm gonna put about 25 to like 50% tension on this tape here. He's still got to go to physical therapy, and the biggest thing is I'm not going to put this over his incisions, okay? So you just kind of have to steer your tape so that you're not hitting the portal sites. You know, so just kind of pick your lane ahead of time. You know, I got that little incision there, that's not a big deal. Okay. I'm gonna rub those on nice. The question I get all the time with this is, does this really make a big difference? And my response to that is, it's not hurting him to have this tape on here, and B, if it gives him even a 1% improvement, then that's good enough for me. That's worth the 30 seconds it took me to prep this tape and put it on him. Anecdotally, I can tell you that this is an absolute game changer when it comes to reducing swelling, especially swelling that's been sitting in an area for a while where your lymphatic system is most likely clogged. So I'm going to repeat the same process. We're going to go in the opposite direction. We're going to kind of create this really cool like fan pattern over his knee. The best part about taping him this way too is there's really no reason for his PT to have to take this off. He should be able to get pad placements, you know, in all of these openings in the tape. For him to kind of do his, you know, more of his traditional treatments with. Okay, boom. So this is a lymphatic drainage application for, you know, some knee swelling or a post-op knee. Again, take special precaution to not hit the incision sites with the tape, just to make it more comfortable for him and easier for any other healthcare providers who may be treating him. If you're the person who's treating him and taping him, then you're making your job a lot easier for the next treatment. You know, so I can still hit his VMO and some of these other areas with pad placement for like Russian or biphasic current. You know, in terms of like interferential or any kind of like other stim or ultrasound treatments, there's still plenty of access to the skin, and we're also kind of opening up that skin to let some of this swelling drain. So now we're gonna go bring him to the Normatec. All right, guys, so the last thing we're gonna do with Matt today is I got him set up on the Normatec. The reason I like the Normatec for like post-op is it's a way to kind of aid his lymphatic return and his venous return without necessarily, you know, having him do a lot of movement, right? So right now this is kind of a passive thing. The machine is kind of compressing each chamber and kind of doing that milk massage of the swelling out of his knee and returning it to his core. So he has legs elevated, he's nice and comfortable here. The other thing you'll notice, I put this strap around his ankles And the reason I did that was because my tables here are really narrow, and when you have the Normatec on, you feel like your legs are constantly gonna fall off the table, so his adductors kind of get really lit up. So I put this strap around his ankle so that he can just relax his legs completely. This is gonna be like a 30-minute treatment. You know, the more you do something like this, the better off you're gonna be, the better results you're gonna get. So we're just gonna let this cook for about 35 minutes, okay? And just let this drain out and just relax, okay? And I will see you guys next time on another episode of Session Sit-In. You can follow me on Instagram at MikeStella_ATC. You can follow AMP on Instagram at AMP_athlete. Definitely visit us online at ampathletes.com/recovery lab. Just wanted to thank you for the time you spent watching this video. And please, if you like what you see, please subscribe, give us that thumbs up, like the video, it really helps. Leave us any comments or questions in the description below. I will be sure to answer them. Again, thanks for your time, and we'll see you guys next time. Less floaty now. Much better on the swelling front. Almost looks like an E.